Sway Health.
Valerie, welcome to the program. Thank you for being here with us.
Yeah, thanks for having me.
So, can you tell us a little bit about Hero Digital and your role and what your team is currently focused on?
Yeah, absolutely. Hero Digital is a consumer experience agency. We really work across the continuum of the consumer journey. And our goal really is to take what can be very complex in that journey and really try to make it very seamless. In particular, I think the one thing very unique about Hero Digital is we are a mix of both agency, and so we have a lot of that creative, and there's also a bit of the consulting arm that allows us to have a bit more of that tech and operational piece. So it's a really nice kind of marriage. We call ourselves bilingual sometimes. It really makes a a difference, and we do that across a number of industries. So I think one thing that also is very unique is I'm in healthcare, very highly regulated industry, but we also work in financial services, technology, manufacturing, and so that gives us an advantage of a lot of those industries tend to be a little further ahead than healthcare. It tends to happen a lot. And so we get that outside in inspiration, I think, being able to, from our agency, being able to see those, bring those into the healthcare space, and really kind of work across those journeys and seeing kind of what's new and what's happening. At Hero Digital, as I said, I'm in healthcare. I'm the VP of Healthcare Strategy. And so for our team, the things we're focused on, I started earlier at the beginning of the summer. And one of the things that was fun for me is kind of where is our right to win and play, right? Where do we really have the most experience in case studies? And I'm really looking, we are incredibly strong in the health systems provider space, but we also have a really, really good chops in the med tech, animal health, mobile health, health and wellness space. So we really have the ability to go across industry segments in healthcare, maintaining focus still with the provider space. And so with that, I said, knowing what we do, which around digital strategy and innovation, experience design, a lot of digital products and that, where can we take that and really apply it across? Just as healthcare is changing, I think it's really important to think about it a little more broadly. And so some of our focus areas, one today, we'll talk a little, we're going to talk about the caregiver experience. And so really thinking about the consumer experience from a little bit different lens. Another area that I spend a lot of time thinking about too is this concept of healthcare changing to a network of services. So, it's great to say we're really good in provider, we're really good here, but as you're seeing in the news and that, things are not so siloed anymore as they used to be. And so it's really kind of coming together. And so you're seeing these very unique partnerships you would have never seen a decade ago with health systems. And then you've got them pairing up with, say, virtual chronic care programs, transportation services. There was recently a connection with Uber and for food and transportation. So, it's really interesting to me to watch how it's shifting and to see how all these are going to become a bit of their own ecosystem. I would say one of the third focus areas we looking at is, like everyone else, technology is moving very rapidly. With emerging technology, how can we compliantly leverage that technology to really do more with less? Because that is really the name of the game in healthcare anymore. And so, there's an opportunity there, and I think there is a lot of value in just trying to figure out those right use cases.
Well, and you mentioned, the caregiver. So I'd like to focus on that a little bit today, of our conversation. So why do you think there is such a big focus on caregivers for, in healthcare industry right now?
So what's interesting is I feel like we've all read for quite some time the population is aging at a very significant rate. Interestingly enough, though, I feel like in a lot of my clients, unless they are organizations focused on seniors, it doesn't feel like the caregiver has still kind of gotten their, they just made their way up in front, what kind of parallel with the consumer patient.
Right.
And it's a bit staggering to me because I've read some numbers recently, and I think in the next 6 years, 1 in 5 Americans are going to be over the age of 65.
Wow.
And there's an expectation that of those, almost 90% will have a chronic condition. So they're going to have to manage care. And the vast majority, I'm sure, will have caregivers to help support that. We actually have really been thinking about this a lot lately. We ran a quantitative study not too long ago to see kind of how those numbers stack up. Interestingly enough, I think 83% of those surveyed came back and said that they do have a chronic condition. They see a specialist, and I think there was over 70% said I mean, they're going to appointments at least every couple of months, and that's a pretty high use of the system.
Mm-hmm.
But one of the other things that we know is a lot of the individuals want to age in place. And
Right.
so when we think about this, you know, there has to be a more of an emphasis on this caregiver experience because we have, I mean, 6 years, 2030 is not very far away.
Right.
And you think about the number of people coming into the system. If you think about folks having to have help in supporting them manage these conditions that most likely they will have,
Mm.
you have to give some agency to other folks to
Right.
be able to help them support them and to allow them to do that aging in place.
Mm-hmm.
Because quite frankly, I don't think the system could handle that many, they can't have that influx, and you have to let folks kind of age in place and at home
Mm-hmm.
to be able to manage that care. And I just don't think, that it's the right place to do it versus trying to do it in some of our, facilities and that.
Right. And, what role do caregivers play in shaping some of the perception of healthcare services? I know they play a big role, but how do you tailor your strategies to meet those needs of the caregiver?
Yeah, it's a good question. It's, to be honest, when we think about the caregiver, and even when I think about it personally and how they shape it, I think of myself, to be honest.
Hmm.
There is a demographic in which, as the population's aging, and so have younger, you have children, plus you have aging parents, and you're in the middle. And I think about, okay, what would I need as if I, knock on wood, my parents are healthy right now, but
Hmm.
if I were to be their caregiver, and trying to juggle my schedule and that. And the first thing I, think, I'm like, I need convenience, right?
Hmm.
I need flexibility. I need convenience. I can't be on the phone with someone for a long time.
Right.
I need to be very aware of, I need to be able to have the information to make a decision and, really make sure that they're cared for and I can monitor and all the things.
Hmm.
And to be honest, I think 60 or 70% of caregivers are female.
Right.
So when I think about that too, it really fits that mold. So I think they're really shaping in the way we our other digital experiences that we have. And if I think about myself, even as a caregiver, they shape that perception, right?
Hmm.
I think I read something the other day that a lot of times you think you're competing with the other brands in your category,
Right.
and that's not true. You're really healthcare is competing against any digital experience that we've had,
Hmm.
and so that really ups the bar when you think about
For
that too
sure.
from our day to day perspective.
Right.
And I think another thing I was reading is, if the organization doesn't get it right, loyalty is
Mm.
really in the toilet these days, right?
For
And
sure.
so I think over 70% of people will just go to the next thing if they don't have that digital experience.
Hmm.
And so for us, it's really important when we're working with clients and thinking about it. That first kind of innovation and strategy piece is, you know, who are we? Kind of what is the vision? Who are we planning for? And so we really think about the personas of the individual. So we may
Hmm.
look at it from the consumer and patient, but we also need to think about kind of who is surrounding them that we need to cater to. What are their needs? What are their expectations as well? We start thinking about the journey that
Hmm.
they're on with them, and at each touch point, kind of what truly matters. So you think about even from a just awareness of a brand,
Hmm.
trying to help our clients think about what does that mean? How do you need to engage with them? Do you engage more through social media? Do
Mm.
you, what are those forms in which someone would be aware of the services?
Mm.
And then how do you actually, once they become aware and something triggers that, how do they really, what's that next step in the journey for them so that they can learn more, be, educated? Like, what is that content that you're pushing and how relevant is it to them?
Mm.
Is it small bites? Is it easy to get to? You may also do a mix of videos for folks, just
Right.
thinking about how people ingest information and learn. And then how do they actually kind of take that next step? And so, is it easy for them to do it?
Hmm.
Do they have a way to, for,
Right.
whether it's scheduling an appointment and those things, what is that capability? And then really on that back end, how do you kind of keep them within your organization and system? And so how do you, that retention piece becomes so critical from a performance standpoint. And so I think about it myself in my own day to day, right? How do you get notifications? How do you get
Hmm.
alerts? How do you make that stuff feel a very seamless part of your life
Hmm.
without, not being burdensome? Because when you think about that journey too, it can be pretty stressful for both the caregiver and the patient or consumer. So
Right.
having that caregiver in mind to take some of that stress out, it's really critical.
It's interesting, some of the examples that you kind of talk about, but it is different. It's similar but different for different type of caregiver. So, they have the busy mom. Can you go online and book an appointment, and you can't be on a call all the time, or I am booking things for my kids or my husband. But then as age, I have my mother is a caregiver for my stepdad, and he has all these different nuance appointments and different care providers that he has. So trying to navigate that system, it needs to be super easy because she has to kind of keep
Yeah.
everything straight. So I love how you talk about convenience and then being there right in front of where the patient is, where they're going to see your information to be able to make that next step as easy as possible.
It's true. I think one thing you bring up is really important is a lot of times as whether if you just general aging
Mm,
or if you have a diagnosis, you may be seeing multiple specialists and
right.
people, and so that ability to have that's where the data becomes incredibly important when
Mm,
we work with our clients, as well as the technology to enable it. These caregivers need some sort of platform or digital tools to be able to truly have kind of that dashboard of sorts of just
mm,
say what's happening
right.
today, what are we doing, making sure everyone's talking, because it does become a burden on
Hmm.
really truly the caregiver to if they don't have that, they're the ones expected to kind of regurgitate all
Hmm.
of that information.
For sure. Can you share for the listeners an example of where the caregiver was a key stakeholder, and the strategies that you have been talking about today has led to improved patient experience and improved results?
Sure, yeah. We for almost 10 years, we worked with a very large senior care
Mm,
organization. And one of the biggest things for that organization is, they provide a variety of levels of service, right? And so many times it's trying to find what is the right match
mm,
almost for you for your loved one and that too, right?
right.
And how does that vary if you're dying, if your health changes, right?
Hmm.
And knowing those options. And so again, it was a lot of times you're doing that with, maybe a loved one or
Hmm.
a caregiver of sorts. And so one of the biggest challenges was a lot of this when we first started was very manual.
Mm,
But the first part again kind of came to that awareness. How do they even know about your services,
right.
right? And so thinking about really that marketing and media strategy to ensure again you're targeting, you're sending the right message. So when that time comes that that brand is you're aware of the brand. But then the other piece, this organization in particular didn't have a very strong digital presence,
Mm.
which a decade ago or so, not a lot of people
You
did.
did it. Yeah.
And, the biggest piece in particular for that industry is getting people to actually come and show up
Mm,
and do tours and that sort of thing. And so, how do you make that very seamless? And so,
mm,
that was a big focus. When we thought about that journey, in particular from a senior care organization at the time, it was they really wanted people to come and see it, feel it,
mm,
even if they're building new
right.
facilities, start to really see what it is, what they offer,
Mm,
because every one of them is really very different. And so,
mm,
that was a big step of engaging them, educating them a bit, and then getting them to take that next action really without having to, have any touch points per se,
right.
to be able to really easily book that tour. So then they
Mm,
could probably that mixed, I think the patient might need to of you have the convenience from the caregiver standpoint to be able to make that step, but then
mm,
you also have it from the patient. They can actually go and
right.
kind of feel and see because that's still critically important as well.
Hmm.
And so we were able to really improve that upfront process to get people in the door, making everyone kind of happy all the way around. But it did really improve their increase in just the tour bookings and
Mm,
then the patient experience. And so the conversion rate becomes much higher because you're attracting the right people because they
mm,
have the content to make those decisions. And so then you really just have a higher likelihood of the people who are showing up. This might be the right
mm,
fit for them.
mhm,
I will say that was one more from a senior care. Um, I've also worked with organizations who think about it from a primary care standpoint of almost like we do with our kids, like a proxy.
mm,
And so they were just thinking, how can, if we're managing chronic conditions and we also need food delivered or transportation, just giving how can they give the caregiver the agency to really be able to consent to make these appointments on their behalf and do the
Mm.
things. And so spend a lot of time with some primary care organizations who served a lot of Medicare Advantage patients,
Right.
thinking again, how do you really allow the caregiver to help support kind of them along the way and making sure that whole ecosystem that they need
Mm.
is kind of coming together.
Mm.
I would say a last interesting one that I worked on was a home health agency. And this one is, I think, particularly interesting when you think about the need for a really good consumer experience for the caregiver.
Mm.
So in home health in particular, as you can imagine, not every person that comes into your home you may not be a great fit.
Right.
And so this organization was really struggling with like, man, we're having a lot of requests for just matching changes, and
Mm.
that puts a ton of stress on the caregiver to they're the one who's going to have to kind of figure that out.
Mm.
And so we worked with them to again kind of define the audience and the personas and that what are the needs, and to develop digital tools and products that allowed you to really build that profile up front
Mm.
of preferences in that, so then you can do the same on the back end
Right.
for your employees, make as best you can a
Mm.
match to try to reduce some of that friction, and
Mhm.
then also integrated a workflow within an app to allow, if for whatever reason it doesn't work out, it doesn't become this arduous process of telephone calls and
Mm.
paperwork. And now you can do a lot of it through digital
Hmm.
means to kind of get the process moving,
Mhm.
just making it much easier because you already have those data points to kind of go through kind of a rematching process. And so they had a lot of success, and just that it's just that friction point and the stress between it, and just a lot
Mm.
better consumer experience for them. And quite honestly, for them, they can manage their workforce a bit better.
I love those examples you gave because it shows the different prongs approach to, like you said, each different persona. The one that rings true, definitely from my perspective, is I said today, my mother, she has a caregiver, and my stepdad has a brain injury. So having someone come in the home, it has to be that right fit. And if it's not, it causes a whole bunch of other phone calls and appointments and conversations that she has to have with the home health
Yeah.
providers to then come and try to find that match. So to be able to have that matchmaking process up front, I think is key for a caregiver. How can technology be leveraged to create a more seamless experience for caregivers? We talked a little bit about it, but maybe you can expand on how that can help as they navigate the healthcare system with their loved ones, which we know can be certainly trying, especially if they're going through a hard time as well.
Sure. Yeah. So technology, I would say the way I think about it, I feel like data kind of is the foundation, and technology is maybe the backbone to it that truly allows us to enable any of these experiences. So,
Mm.
the first place we start to map out what that looks like. And then you have to figure out how the technology can really support it and bring it to life.
Mm.
I think the exciting part is the technology is changing so fast that there are definitely, it's much easier to think about and come to fruition than maybe even 5 years ago, to be honest. But it truly is kind of the backbone, and I think it's just really for us in the organization, it's finding the right tech stack with what they have today. And part of it is, right, can we use what you have today? We're seeing a lot of our organizations, there's a ton of growth and acquisition in the market, and so part of it is just really thinking what is the most seamless way to do this, because when you think it from the back end standpoint, data is all over the place. And so I think that's kind of the first place to start. We always talk about getting your data right and having good data strategy is critical. And when you even think about it from the consumer and caregiver, as you mentioned, you've got a patient who likely has a very long history that you have a lot of data, and they may be seeing multiple specialists and physicians, et cetera. And so there are so many data points to go in here around it. It kind of allows you to be able, if you can use technology and data to create a profile
Mm.
of both the consumer and the caregiver that really can seed any of those personalized experiences you want to serve up to them through the technology, right? If you want to allow them to select their preferences, and then, that's how you notify them, whether it's text or email or et cetera. Having that data strategy and that platform and structured data is so critical to really, even whatever you want to do today, but thinking how you can leverage emerging technology that's going to be coming down the road. It really does set you up for success. It is hard. It's not a shoe. I feel like every time we talk to clients, they turn, it's like, oh my goodness, that's another data source. And look,
Mm,
we're talking about healthcare. When you talk about data, you have to talk about privacy and security.
mhm.
And so that becomes another piece of it's not so easy. You can't just kind of willy nilly be sharing information, right? You have to have consents, the right consent set up. You have to write the right proxy if you're talking about a caregiver. And so just making sure that the technology is flexible enough and to be able to ingest and adapt because you can take away and improve consents right at any point in time. And so really be able to have the system that can take that, can be flexible and can serve it up in the way that you need it to. And I think the technology can be really important too from even a content standpoint. When I think about the caregiver, if you really have tools that allow you to have dynamic content, that you can really make it such a wonderful experience for them to keep continuously serve them information, education
Mm.
on maybe the chronic disease that they're helping support, right? And being able to kind of help them along the way, as well as really serve them up even information about their own.
Mm.
How
Yeah.
do they manage their own day in that? Because that they do carry a lot of burden and stress. So
Mhm.
the more information you can serve up to them too, I think the data kind of allows you to do that.
And you talked about data, so we're going to kind of expand a little bit on, the role that data plays in, like we were saying, personalizing communications to, or I guess, and services to the caregiver. So, how have you seen, or what are some of the examples that you see how that data has enhanced the overall patient experience?
Yeah. So I think, we hear about it a lot, but it comes in varying levels around personalization. You say, everyone wants everything personalized.
Mm.
And I think that's rightfully so. As we talked about at the beginning, we're all comparing any digital experience to Target, Airbnb, DoorDash, what
Amazon, yeah,
Amazon, right?
yeah.
We expect everything to push us, hey, you bought this, this is what you
Hmm.
like, sort of thing. And we expect that in healthcare. And I think it is more difficult than that because of you have to be very aware of the privacy and security and
Hmm.
concerns. But, taking those use cases and saying, how do I, you can even start basic. Hey, caregiver, how do you like to be communicated with? What is easiest for you to schedule these appointments and that, and making sure that they have, you're building a system
Mm.
in which you've got an omni-channel kind of experience for folks. And so you have to have different data to serve up to each of those audience, kind of the audience segmentation, and that you have to have the data to say, okay, person X, you like this, you have these preferences. I'm going to, push this information to you. And I
Hmm.
think, really thinking about at each step of the way, what is the data that they need? And really, how can you activate that for them? So when we think about that journey, we really go to that level of granularity. You kind of think about it from consumer and patient. What do they need? What does a caregiver need? What are the tools that will help do that? And then what is that underlying data and how easy or not easy is it to get to? From a compliance standpoint, can we really be able to do that and really serve up that dashboard?
Mm.
We all have this vision of you wake up. I'm a caregiver. I open my app and there's this dashboard that says, good morning, Valerie. Your mom needs, has she taken these 5 medications
Mm.
today, and having a bit of a checklist. And I think that really is the ultimate goal,
Mm.
there's all these silos of data living in apps and stuff. There's a lot of cool apps and things that are out there.
Mhm.
And so I think the vision is, that organizations have to be thinking about is how, again, kind of from a network of services, how do you take that and get it into a single place to
Mm.
really make a caregiver's life much easier so that they can do that medication management. They can do, maybe they're doing remote patient monitoring. That's a whole other set of data. Say if you have some heart condition, remember, and you're at home and you're wearing a Bluetooth device,
Mm.
and so tracking any of those stats, that all has to come together, and so you can help monitor if there's something off.
Mm. And that's the ultimate goal too. When you said that, like, good morning, Valerie, I picture, when you check into a hotel and it
Yeah,
says, good morning, Valerie, or welcome, and has all that information right at your fingertips of here's what you can eat, here's where you can go.
right.
That would be beautiful from a healthcare standpoint and make it just so much easier for the patient and a caregiver.
Yeah,
Hmm.
your medication, your recipes. You
Hmm.
think about that. We had a client that we were, as I mentioned, was primary care for Medicare Advantage patients. And we thought about if they have diabetes, could you then, whether it's the caregiver's cart or the patient's cart, if say their Lancets were up and say, hey, all of a sudden it appears in their cart and it's a recommendation because
Mm.
this organization had retail side data as well as healthcare data. And
Oh,
like,
interesting.
how do you start kind of just marrying that to really provide a really good experience
Mm.
and help them really tangentially manage, that condition?
So I want to talk about trends. So, what are some of the trends that you're seeing in the healthcare marketing space when it comes to caregiver support? And there's a lot of trends going on, but how do you stay ahead of all those trends that are kind of always popping up?
Yeah, it's a lot. It's busy because I think when you think about healthcare in particular, there's so many segments underneath it, and
Mm,
just trying to kind of keep up with not only kind of what's the latest and greatest thing that's happening, but also the latest and greatest regulation that's changing
mm,
and reimbursement and that. And so, kind of have to take a step back and kind of think about how it all comes together. And so for our organization, we do, we stay very close to a lot of the associations. We have,
mm,
I think I'm probably signed up on a daily basis to 5 or 6,
mm,
various newsletters that come in that they give you the great sound bites, right? For
mhm.
me, it's the same sort of thing, right? I need information served up to me
Yeah,
as well,
super
right?
easy. Exactly.
And need to digest that. Obviously, working very closely with our clients, monitoring from a regulatory standpoint, we stay very close to what legislation is happening and what's going on there. And like I said, we're in a really unique position to have colleagues in tech and retail and other places, so we can
Mm,
kind of see what trends are happening there too that we could expect. It will take longer, but that may make
mm,
its way to healthcare. And it's also interesting too because we do serve kind of your traditional provider clients, but we do have folks in the health and wellness net, and they can move a little faster. They look a little bit different than obviously your provider, and so it is fun to have both because you can see how some of the disruptors in the market can move faster and how
mm,
they're really trending
mm.
towards that kind of digital experience we all want,
Right.
and then how do you kind of marry those. But to your point, there is a lot going on. There's a I think a good thing. There's a ton of apps and
Mm,
different things to support the caregiver right now. And you really see it around, I mean, you see a ton around medication management,
mm,
chronic disease management, even the remote patient monitoring ones, whether that's kind of wearables and that you can have a dashboard to track.
mhm,
There's a lot of that going on, which I think is great. You're seeing a lot of niche offerings in the market. We're even seeing them we're seeing a lot of like the virtual care chronic management and that you see, and that's awesome. It's wonderful. They're filling a gap, but it does sort of create these pockets,
mm.
right? Of again, how do you get all of that data
One
into
place.
a single place? Because then you just have a caregiver managing 5 or 6 apps, and that
Mm,
becomes pretty stressful too. So I think again, it's there's the right pieces, and I think part of it is, we help our clients. How do we kind of what is that vision to kind of bring some of that together so that you really truly are making it easier and not just making it a bit of a patchwork. And so another trend that one quite actually it was a organization that won quite a few awards is they were showing how they on their website present content, and a
mm,
lot of the content was not just to the patient, and they
mm,
a lot of visuals with the whole family around,
mm,
and it was around, I think, heart disease and that, and so it was very much geared towards content and education, how to management from a whole family perspective. So your lifestyle, your food, et cetera. And so it's interesting to see how there there is some more support and
mm,
education and resources that are being kind of shifted towards that as people I think are recognizing that it's not going to be the
mhm.
impetus is not going to be just on one person to kind of control
Right.
all of them.
I love that. Yeah, because it's not just affecting the patient, even though it's their ailment, but there's a whole village of folks around them that is also affecting. So being able to support those folks is key too.
Yeah, absolutely. I think the other thing that you see a lot of, and COVID was 100% sparked this, but just from the virtual care or telehealth
Mm,
platforms, I think that is coming through these niche offerings. You're just seeing a lot more of that coming through too, which is, I mean, from a caregiver's perspective,
mhm.
is huge. And I
Right.
think, we'll continue to see that being embraced. I know there's a lot going on from a legislative standpoint for
Hmm.
reimbursement and that, but I do think that in particular, when you think about what that experience be, it has to be a part of the experience for a
Hmm.
caregiver. I mean, it just makes any of the follow-up stuff, which there's plenty, right, with preventative care and chronic disease, that doesn't necessarily mean you have to take the day off,
Hmm.
spend $30 to park in
Right.
a parking garage. That whole thing, you can do that with your loved one in 10
Hmm.
minutes, make sure you're okay. You've got if you have that picture with all the vitals and all that, and it's like, hey, you look
Mhm.
good. It really could be much easier. We were doing some work not too long ago with the client and looking at just what some of the electronic medical records are coming through and some of their roadmap. And there is, I mean, I will say it excites me that
Mm.
there's a lot of cool things coming kind of down the pipeline of, I think I was reading a use case in which if you had a chronic disease and say you were supposed to have a follow-up appointment, um, you could you go get your lab work or whatever it may be, or you have your vitals, and a virtual assistant would
Hmm.
read it and could say, "Oh, they're within the
Right.
range that it needs to be. Looks great. I've already scheduled your next appointment. You don't
Hmm.
have to have the one tomorrow because they look good. Great." And I was like, "Gosh, that would be
Mhm. Great.
that could save a caregiver just hours
Mhm.
of their day and stress in doing that." And so I do love those trends of how we're really embracing that being more of that care from your home. And I think
Mhm.
we're going to have to see, more of them.
Okay, so you talked a little bit about legislation. So let's talk a little bit about that. So there has been some proposed and talk of coverage of in-home care and some legislation around that. Do you expect to see more of that on the federal level? And how much impact um, does that have around the role of the caregiver?
Yeah, it's huge, right? I mean, I think in order when we set up these journeys for our clients and have to think through that, part of what the organization has to think about is if it isn't just a out of pocket sort of
Mm.
service, you do have to think about what am I allowed to do, document, bill, and how does the caregiver have any, if I'm
Mm.
talking to a caregiver, how does that work? And so I do think it twofold. I think we have seen a lot. I mean, there it kind of goes ebbs and flows. Like we
Mm.
hear talk in the legislation of we're going to do more, a lot of the Medicare rules will come out and proposed rules, and they'll say we're going to do this coverage. I think it will. I do anticipate that we're going to see more of it,
Mm.
and it will probably gain traction. Only because we just don't have the system just can't support the number of folks coming in.
Mhm.
And, truly, if you're able to, with all the technology we have, the ability to care for our aging population at home is so much less expensive than
Right.
having them in the hospital
Right.
that, we have such a we're going to have such a strain on our system anyway. The more that Medicare doesn't have to, obviously pay out for hospital visits and that and it's just not good for the patient or
Mhm.
obviously the caregiver if someone's has to be admitted to a hospital.
Mhm.
And so the outcomes are always better if you're at home.
Mm.
It is much less expensive. And so I do think that there will be a push. It just doesn't make any sense not to. And we just don't have the capability to
Mm.
do it. So I do think you're going to see more of that. And you are seeing a little bit of, I mean, there's some hospital systems that have made some pretty big investments in the past few years around hospital at home.
Mm.
And there's been some pretty interesting news stories on it of just from the patient and caregiver. I mean, some of the people who just really engage with the health system so often because of their chronic condition and to just push people to them and nurses and PAs and into their home. It is just so much more effective to
Mhm.
do that versus taking up a bed and really their level of acuity. They don't really need to be in the hospital. The hospital is not a
Right.
great place for them, especially as you're aging. It can cause a lot of additional problems, and so
Mhm.
I anticipate we'll see more of that as our population just grow. That population grows.
Awesome. Well, I think we're coming near the end of our time here. Is there anything else you want to add before we kind of wrap up the conversation?
Yeah, no, thank you. I appreciate it. Thanks for having me today. I think this is such an, I mean, thank you for highlighting, this topic as well, because I do think it's such an important topic. And I hope that we hear more people talking
Mm.
about it because I do really think you have to be really, it doesn't just happen, right? You have to be very thoughtful about it because there are definitely rules and regulations around it. And you have to also think about what it may mean something very different for the patient and consumer than it does for the caregiver.
Mm.
And so, organizations kind of have to think about that parallel path that they might have to design
Mhm.
in order to meet both needs as it goes along. So I'm really excited to
Mhm.
see kind of what's going to come and, really how we use technology to bring it forward.
Mhm. And also, it's something that affects everybody. So not only the organizations, but as everybody here at this conference and who you talk to at one point are either going to be a caregiver for potentially kids or their loved ones
Yep.
or a spouse. So They may not be thinking about it right now because it's not directly affecting them, but further down the line, it's going to. So having those conversations and being prepared for that, I think, is something everybody should be at least thinking about as
You're
well.
you're right. I mean, when you think about the generations that are going to be taking on this responsibility,
Yeah.
it's the ones. If I had my phone here, it's this, right?
Right.
We like they're attached. They're almost like an attachment to our body,
Hmm.
and so if we're not thinking about them and that experience and how we need to be able to do that, you've already lost that whole
Right.
group of people because that's just kind of the baseline for them
Hmm.
now. And so I think those investments are just critical now because it's happening and it's only going to grow.
Well, Valerie, thank you for being here with us today, and I hope you enjoy the rest of your time here.
Thanks.